Now comes very simple question. Somewhere you want us to put ice, somewhere you want us to heat, somewhere you want to do this ultrasound that you want to do. Which is used when? Very important question.
Very important. Okay. So ice is cold. Okay. So it basically what we call constricts your circulation. So it stops your circulation. Heat is hot. It increases your circulation. So cold reduces the circulation. Heat increases the circulation. Now sometimes people ask me, oh my God, last time you told me to do cold. Why are you telling me to do hot now? So I say, but last time you had another problem and this time you come with another problem.
If you have an injury, acute injury and swelling, you need to compress the blood vessels. You need ice.
Absolutely right. You have to. So ankle sprain, shoulder pain. I've played tennis too much and I've got a little swelling and I've got an elbow pain. So any joint where there is repeated overuse injury and there's swelling, knee pain, definitely do icing. Okay. The first 24 to 48 hours.
Any injury, if you have fallen down, if the swelling has started increasing in front of your eyes, you have a hematoma, you have subcutaneous blood, immediate ice compresses, don't look at it for at least 10-15 minutes blindly.
Yes, absolutely right.
So that the vessels constrict and your tissue edema reduces.
Absolutely.
So whenever acute injury, even if you are bleeding on the side, to stop the bleeding also, besides compressing your bleeding, you should be doing some cold compresses.
Absolutely right. Absolutely. Now, when I've gone into a spasm, like I went to bend down because I went into a spasm, my neck got caught up. The best is hot because the muscle has gone into a spasm. It's in a state of tension. I want to release it. So what I need is a hot water bag, which will help improve the circulation and my spasm will come down. Now, one more thing which I add on to a hot water bag, especially with a neck or a back spasm, is, you know what, take a hot water bag, the old hot water bag, fill with nice hot water. Take our Turkish towels, which you use for our hand. Put it in sada pani, rinse it, okay? Wrap that around the hot water bag. Now, because that's moist and the hot water bag is hot, you get moist heat, which will add better results to relax the spasm, okay? Second, if it's the neck, you lie on it. If it's the back, you keep the hot water bag on the back. So you lie on your stomach. Because a lot of times people will lie and slip in the hot water bag under your back, and then you're in that arched position. And when you get out, you got more stuff. Okay. So if it's the neck or the upper back, you lie on. It's great. It'll feel very good. But if it's the low back, you lie on your stomach and put the whole thing on your back, which is safer. Yeah, but you know what? Usually I feel nowadays the hot and cold really does a good job. Only problem happens when your muscle, like you have tightened on, you have knotted muscles in your body. Sometimes you got a tight glute or a tight IT band or a tight triceps, So if you feel that there's a knot in the muscle, then you need to ultrasound or you do a little massage and then icing. Then you don't need to do a hot pack. But usually the difference is spasms, hot pack, acute injuries, cold pack.